You sit at a desk. They sit at a desk. You have sales reports. They have book reports. You need supplies. They need supplies. Business is a lot like school. That's why your small business should take advantage of back-to-school deals at Staples. Now, Staples 1-inch 3-ring binders are $1.92. 1 subject notebooks are just 25 cents, and 2 pocket poly folders are just 35 cents each. Make back-to-school your business at Staples.
In-store only while supplies last. Offer ends 9/1/18, limit 30.
Blog Talk Radio.
Welcome to Partners in Health and Biz with your host, Gail Dixon. Tune in every Saturday, 9 a.m. for great shows about obtaining and maintaining health, business, and finance. Learn from the experts here at PIHradio.net. And now, broadcasting from the Partners in Health and Biz studio, here's Gail.
Well, good morning, everyone. Welcome to my show. Welcome to Partners in Health and Biz. So happy you could join me this morning. And if you have not been to the website, you probably have, today's show, we have a very special show for you, Immunization Awareness, with my special guest, Tom Schafer. So let me tell you, we're going to give out the call-in number. We have enough room this morning for one caller. The call-in number before we begin is 347-945-7433, 347-945-7433. Press 1 if you have a question or comment, and you don't have to do anything if you just want to continue to listen to the show. So let me tell you about my special guest and what this show is all about. My special guest this morning is Mr. Tom Schafer. Tom is a project director for the National Public Health Information Coalition. He retired from the Illinois Department of Public Health in 2014 after 27 years as communications chief and deputy director. Prior to working for the agency, he was a reporter for Gannett News Service in Florida and Illinois. And Tom has a wealth of information to share with us about immunizations this morning. We're going to right now open up Tom's mic and welcome him to our show.
Good morning, Gail.
Good morning. Good morning, Tom. How are you?
I'm good. Thanks for that nice introduction.
You scared me there for a minute. I'm like, where is Tom? Because you called in on a different phone number, but I said, okay.
Oh, I'm sorry.
Yeah, that was kind of frightening. But we're all together. My listeners are anxious to hear what you have to say, and I'm so happy that we finally were able to pull this off and arrange the interview. And so, wow, August, Tom, the reason why we're having this show is National Immunization Awareness Month. And so my question to you, my first question, is this an annual observance and by whom?
Yep, it definitely is annual, and it's something that we do, the National Public Health Information Coalition, which is a group of public health communicators from throughout the nation, and the Centers for Disease Control and Prevention. We do this every year to highlight the importance of immunizations. Schedule it for August because it's a good time as parents are getting their kids ready to go back to school. There are certain immunization requirements that they need to know about. So it seems to be a good time. So we try and do this every year to make sure everybody is aware of the importance of immunizations and what they should do on an annual basis.
Okay. Wonderful. So, can you give us a little more information about the organization? When was it established, and are you a doctor? I believe some of our listeners are probably going to want to know. Well, how did you get your wealth of information about immunization?
Well, I'm not a doctor, and I don't pretend to be one. I in my career. My career at the Illinois Department of Public Health, I spoke for our director, all the time because he just didn't have the time to do all the interviews himself. So it's just information that I've gleaned and studied and been made aware of throughout my career. So that's kind of what we do at the National Public Health Information Coalition. We're members started. You asked when we started. Actually, it was about 1987. I was one of the founding members, and it was we got together with CDC, and there was concern that there wasn't a lot of communication between us and the federal government and the states, as well as other federal agencies, and between the states. I was in Illinois. I really didn't even know my counterpart in Iowa, for example. So our organization has kind of pulled all that together. So we now know each and every one of us that represents the 50 states and U.S. territories, and we have a very good communication link with the Centers for Disease Control and other federal agencies. So it's kind of for us, it's a win-win to further us with knowledge about what's going on in the public health world, and to be able to explain that to the public, kind of like what we're doing today.
Okay, wonderful. So I want to jump around a little bit, but we all receive many vaccinations. There are different people that we hear about the different types of vaccinations that are available, such as the flu, getting the flu shot, and HPV, and there are all types of immunizations that we can get. Some say they are unnecessary, and others claim they can cause certain conditions such as autism. I've heard that. So my question is, are vaccinations safe? And is this true about some of these type of vaccinations possibly causing diseases?
Well, vaccinations and vaccines in general are just extremely safe. They're tested annually, regularly, for each and every day by the federal government. I think people should feel good about the vaccine supply that we have in the United States and what important things it does to protect us from various diseases. Now, you did mention the autism thing, and that's got a lot of traction over the years.
Right.
Actually, this kind of goes back to a study that was done in 1998 by a British researcher who published a paper that stated, that MMR, which is measles, mumps, and rubella shot, causes autism. And, it was widely publicized because it was in a very good medical journal called Lancet. Got a lot of traction, and a lot of people who had concerns about vaccines cited that study. And, a lot of scientists around the world were very surprised, and they tried to replicate what this gentleman had come up with. And it was later discovered that this was a fraudulent study, and it was discredited, and the publication that actually put it out had to retract it. But it's kind of lived on, and people keep repeating that, and it really isn't the case. Now, there are anti-vaccine people who are concerned about, having their children immunized. And what we just suggest, like I said before, I'm not a doctor. What we suggest is that people speak to their healthcare provider about their concerns and, better understand what these vaccines can do to protect their children as well as themselves. So it's got a lot of traction, like I say, but it's something now that's almost 20 years ago that this study came out, and people still cite it, even though it has been discredited, and the publication had to withdraw it from its resources. So it's a good question. It's something that comes up all the time, and it's people are concerned about the safety of vaccines. They should talk to their healthcare provider.
Right. Yes, I remember last year, maybe 2 or 3 years ago, I had on my show a naturopath and a medical doctor, a general practitioner, and the naturopath was saying yes, people should not be immunized because she was saying we don't know what's in those shots that they're giving us. We don't know what actually is in them, so we shouldn't We shouldn't go. We shouldn't be immunized. We shouldn't have our children immunized. And then the medical doctor was saying, just like you, yes, people should be. They should get their checks, their shots, and they should be immunized. So thank you for clearing that up for us, Tom. Thank you so much for clearing that up. So I wanted to know. I know there are all types, like we said, all types of vaccinations. People start getting their children prepared for school, and we know that there's certain shots that they need to have before they go to school. And then adults, there are certain immunizations that we as adults need to have and to stay on top of that. But why should babies and infants be immunized?
Well, babies are it's just a good time to get them started and get them protected from 6 months, 2 months, and on, just to be protected against. There's actually 14 serious diseases by the time they reach 2 that they can be protected against through immunizations, and it's kind of tough as a parent to take your child in and see them get all these different shots, and they're usually pretty happy, and then that nurse comes in and sticks that needle in their leg, and they're crying, and they may get a slight fever later on and have soreness there. It's not the most pleasant thing in the world, but things like measles, we talk about it as a childhood disease, but in infants it can be deadly. So there's these outbreaks that we see on a regular basis, even though we do vaccinate in the United States. But usually what happens are unvaccinated people, spread the disease after they become exposed, oftentimes from people who travel abroad and pick up measles. So, it's something that we should do starting, pretty much right after birth. It starts at 2 months with a recommended schedule that the CDC has. But it's the important thing is you're not only protecting your child, but you're protecting the other children that they interact with. Whether it's in a preschool program or some other school, child care facility, we're kind of all in this together. And while immunizations, provide protections, they're not always fully, protective. Sometimes it can be 80%, sometimes 90%. But when all of us get vaccinated, we protect each other. It's when there are segments that don't get vaccinated, and then they introduce that disease into a small community such as a preschool, it can spread rapidly. I mean, these kids aren't trained to wash their hands and cover their mouth when they sneeze and those kind of things. So, like I say, we're kind of all in this together. It's actually called it's called herd immunity, where the more people who are protected against a certain disease, the better off it is for the entire community. And you see, these outbreaks that start like in some religious groups that don't believe in medical interventions, and it becomes serious rather quickly to that community as well as people who live around them and interact with them. So it's important for all of us to be in this together and to make sure our children are protected against all these diseases. And there are things that have been eradicated in the United States as a result of this. I mean, polio being one of those. I read a story this week about I think it was a woman who is the last person in the United States that's being kept alive on a daily basis by an iron lung, where they are put inside this device to keep them alive. And, we don't see that anymore in the United States, and that's obviously a good thing. And things like measles and mumps and diphtheria and whooping cough. You do see occasionally stories about outbreaks, but they're fewer and far between. And actually, the CDC said a few years back that measles had been eradicated in the United States.
Right. I was going to ask you about that. I did hear that measles were eradicated in the United States, and I was just wondering, because I've been hearing that the measles are coming back. People are having outbreaks. So is that because people are not getting immunized like they should? Reason why it's